Hello everyone. So in the second lecture of reproductive health, we are going to start with the contraceptive methods or what are contraception exactly. So let us see what are contraception, what are the contraceptive methods. Okay, so we are going to start with the contraceptive methods. Or first of all, we should know what is contraception, right? So contraception is a process or methods which prevent pregnancy, right? So these are the methods which actually allow intercourse but prevent pregnancy. So methods or processes which allows intercourse. So these are the methods, they are allowing intercourse but they are preventing the pregnancy, right? So methods or process which allows intercourse but prevent pregnancy. So these are the methods that's called contraceptive methods or contraceptions, right? Now, what all the methods we will talk about, we'll see. But before we exactly come on to the method of contraceptions, let us see what is the characteristic of an ideal contraceptive, right? So let us see the characteristic. I mean to say what should be our features, right, of a ideal contraceptive. So characteristic feature of ideal contraceptive. So what we expect from contraceptive, first of all, so we expect that it should be have very lowest failure rate, right? So it should have, that is the first expectancy we have. Although no contraceptive method has 100% efficacy rate, so some failure rate is there. Again, it is depending on how the person is using them. So should have very less failure rate, should have negligible or very less failure rate. So that is a something, that is a first expectation all of us have from the contraceptive methods, right? Apart from this, what all we expect, that it should be cheap. I mean to say it should not be costly. So should not be very costly. That means anyone can afford them, right? Apart from this, they should be available at everywhere, almost should easily available, should be easily available. So they should be easily available. Apart from this, they have low cost, so we have written already that they should have the low cost, right everyone? What else we expect? They should have negligible side effects, so should have less or negligible side effect, negligible side effects, right everyone? Apart from this, we also want, so what else we want from a contraceptive? So it should not affect with the sexual libido. I mean to say it should not affect with the sexual drive or gamete formation, rather we should say. So the contraceptive should be like that, should not affect, so it should not affect gamete formation or sexual libido also. So gamete formation and sexual libido, and sexual libido. Libido means urge, sexual urge. It should not affect the sexual urge. Apart from this, what else we should expect from a contraceptive method? It should be reversible. I mean to say it should not be permanent. That means if a person or if a couple again want to regain their fertility, so it can be, right? So that should be reversible. So it should be reversible. These are some of the points which should be the characteristic feature of an ideal contraceptive. So when we speak on the ideal contraceptive methods, that what are the ideal contraceptive, then these are the characteristic of our ideal contraceptive methods. Now let us actually start with the contraception, right? Or let us start with the methods of contraception. So what all we study? So we have few of the methods. So let me list out the methods. Name first of all. We will study about natural method, that how can naturally, if we are aware about the body physiology and so we can prevent the contraception naturally as well. So what is the natural method? We'll talk about them. Apart from this, we'll also talk about some of the barrier methods. They are also called as mechanical methods. So barrier methods are also called as mechanical method. Apart from this, we will also study about chemical methods. Now, within the chemical methods, we will study about some certain subheads such as the spermicidal jellies. So, we will talk on spermicidal jellies, simple spermicidal jelly. We will also talk on hormonal pills. And under the hormonal pill, again, we'll talk about two kind of things. So, we'll talk about combination pill, combination pill. We'll also talk about only progesterone pill, right? So only progesterone pill. We will also study about emergency pill that should be given in emergency only. So emergency pill, right? So that is also we will study about it. The next what we will study under the chemical method is implants. So what are implants? We'll see exactly, but all these things comes under the chemical methods. Apart from the chemical method, so first natural method, second barrier or mechanical, and then I think I have written method only, so it is mechanical, right? Okay, so chemical method, under the chemical method we'll talk on spermicidal jellies, we'll talk on hormonal pills and implants. Apart from this, we'll also study intrauterine devices. So that are implanted in the uterus. So usually we call them copper T, but what all other devices we have, we will also understand. So intrauterine devices. Apart from the intrauterine devices, at the last we'll see the sterilization method. That's what we call the surgical method also. So in this particular lecture, let us start with the natural methods first of all. So let us go with the natural method. Now everyone, if you can recall the lecture on menstrual cycle, so we have studied that menstrual cycle in detail. So over there also I told you that some of the time in a menstrual cycle, that is fertile only. So if we can avoid the fertile period of the menstruation, then we can avoid a pregnancy. So under the menstruation, under the natural method, the first one we are going to study the safe period. So what is exactly a safe period? Now understand what I'm trying to say. In a cycle of 28 day of a female, prior to ovulation, say 14th day, suppose on the 14th day ovulation is taking place. So prior to that, right, 1, 2 or 3 day prior to that, suppose 14th day ovulation is taking place. So from 11th day, let's say from 11th, 12th, 13th, 14th, it's not that much safe. Or 15, 16, 17, also they are not very safe. Suppose in these days intercourse happens, so there are chances of fertilization because nobody is sitting and counting the day, counting the day for ovulation only. It may possible in some women, it may takes early or sometimes it may delay. So if we avoid 10 to the 17th day of menstrual cycle, then we can avoid pregnancy, right? We can prevent pregnancy as well. So let me write it here. So avoid, in the safe period, avoid sexual intercourse. Avoid sexual intercourse from 10 to 17th day of menstruation, of menstrual cycle. So it is called a safe period. So you can think by yourself. We know that that is a fertile period actually. This period of a women menstrual cycle, that is a fertile period actually. So if we are avoiding sexual intercourse during that time, there are no chances of fertilization. Very simple. Before 10, of course, at the 9th day or 11th day, of course, ovulation can't take place usually. So we are avoiding this period because this is fertile period. So simply we can avoid the fertile period if we want to avoid pregnancy, right, everyone? So that's a safe period. That's the first thing we need to understand. This come under the a natural method. Now the second is called as coitus interruptus. Coitus interruptus. It is also called as withdrawal method. It is also called as withdrawal method. So what is the withdrawal method or coitus interruptus? As the name suggests, interrupting the coitus. So if a man, although it has a high failure rate, why it has, I'll let you know. So suppose if a man ejaculate or if a man avoid deposition of semen, in female reproductive tract. So during the intercourse, if a man realize that he is going to ejaculate, so that time the man can take out the penis outside from the female body and he can ejaculate outside. But of course, it is again up to the person. So that is why it has a high failure rate, right? So that is what is the meaning, that withdrawal method. So why? Because penis is withdrawing from the female reproductive tract, that means from the vagina, before ejaculation. So ejaculation should not be there, or ejaculation should be avoided in the female reproductive tract. Of course, then fertilization won't happen. But why it has a failure rate? Because sometimes if it is reported that a man, till the time men recognize or realize that he is going to ejaculate, sometimes precum also releases, that means lubricating secretion. So sometimes it also has some of this one. So chances of fertilization are there. That's why it is a not a very sure method, and it has high failure rate. So that is the second, that is coitus interruptus. Apart from this, we have the another method also, that is called as lactational amenorrhea. Lactational amenorrhea. So it is amenorrhea. Wait. What is the meaning of lactational amenorrhea? That means absence of menstruation. Absence of menstruation during lactation. So we know that when a female lactating means when the female feeds the child on her milk, at the time menstruation is not there. Highly lactation period usually. After parturition, lactation would occur for the next 6 months usually, maximum, right? Okay. So during the lactation period, when the female intensely lactating, that time menstruation remain absent. This is because of very low level of gonadotropin. If someone asks you the reason that why lactational amenorrhea occur, so this occur due to low level of gonadotropins. Now you can understand during the lecture of if you go and see the lecture of parturition, so we have a speak on that after parturition, because level of progesterone and estrogen goes down, and that's how it activates pituitary to release prolactin, and of course it then suppresses gonadotropins, right? That means LH and FSH, hence menstruation won't occur. That is why during the lactation amenorrhea, menstruation remain absent, and even if during that time if there is a sexual intercourse occurs, then women can't get pregnancy, right? Okay, so these are the some of the methods which are natural method we have discussed. Let us now quickly study about the mechanical method also. So second is called as barrier method. These are also called as mechanical method. Now, why they are called mechanical or barrier method? Because they won't allow the meeting of egg and sperm. These methods are so called because they would not allow they would not allow the meeting of egg and sperm, right? So what are the methods we have? The methods are available for male and female. So first of all, let us talk about condoms. So condoms are, one of the safest method. Why I'm saying safest? Because we know that condoms not only prevent fertilization or pregnancy, they also prevent the transmission of sexual transmitted disease. So condoms are made up of latex basically, so they are available for males as well as for female. So in case of male, we call them as a male condom simply. For female, we used to give the term like femidom. So what about the male condoms? I'm sure you have observed it in the NCERT. The diagram is given. It has a one grip like grip over there. So men has to cover the penis with the male condom, right? And so that ejaculation occur within the condom only. Also, because condoms is cover the complete it completely cover the penis, so it avoid the direct touching of the parts. So it is something like that. So that is something like that. Okay, so this is called grip, and with this grip it is completely cover the male penis, and that's how ejaculation within the female reproductive tract prevented. So that is one of the important thing we need to understand. If we observe the female condom, so it has two openings. The upper opening is a smaller like that, and the it has the structure like that, of course, and it has the outer opening that is bigger. So from this small opening, this is inserted into the cervix, means through vagina, and the outer opening remained outside, and a man has to insert his penis within the outer opening, right? So again, these are preventing the direct touching, and that's how they are preventing the transmission of sexual transmitted disease also. So that is about the condoms. The important thing is that, because we know that prevention is better than cure, right? Uses of condom is, and that is one of the choice, most important, that is a first choice of maximum couple to have a condom. So also, that's the important I was writing. The important thing is that condoms not only prevent pregnancy, they also prevent transmission of STI stand for sexual transmitted infection or sexual transmitted disease, that is STD, along with pregnancy. Along with pregnancy. So along with pregnancy, they also prevent the transmission of STI. Right? Okay, so that is a one barrier. Okay. Within the barrier method, then there are methods which are available for the female, and in that we have cervical cap. So second, we have say cervical cap. We have diaphragm. So these devices are available for females only. About the cervical cap, that is a cap-like structure. Female has to insert that cap within the cervix. So say I'm just trying to explain, that is a cap-like structure. It is say this is a cap-like structure. I'm just trying to show you. You can see the NCERT for that. The diagram is given in every help book on internet, of course, so you can go and see that. So this is a cap-like structure. So this cap is inserted, like it keeps sucked toward the uterus, so it closes. So both of the things, what they do, they closes the uterine opening. So we know that cervix internally opens into the uterus, and outerly outward it opens to the vagina. So we insert that cervical cap in such a manner so that it keep fitted, and it prevent the transmission of, or movement, or transmission of sperm to the uterus. So it prevent the transmission or movement of the sperm to the uterus. So that's how they work. So cervical cap and diaphragm, they are only used for females. So these are some of the barrier methods. The most important one we have discussed is the condoms only, right everyone? So hope you understand about it, hope you understood about it. So in the today's lecture we have covered we started with the contraceptive methods. So within the contraceptive methods we have covered natural method, again having a failure rate. Barrier methods we have also covered. In the next class we will see the chemical methods, and we will see about the spermicidal jelly, hormonal pill, and the implant. Of course we'll cover the what we so called as contraceptive method in 3 lectures. So the next lecture would completely be for chemical methods, and yes, it is one of the method that is also chosen by the women's. So the major focus for the next lecture would be there on the hormonal pill. So till that, thank you very much. If you're finding our lectures good and informative, then do subscribe to the channel. Thank you very much.